Welcome everyone to our PERVADE in conversation with Dr. Camille Nebeker. I'm Matt Bietz. I'm filling in for Michael Zimmer today, and I'm a lecturer and researcher in the Department of Informatics at University of California, Irvine. Much of my work focuses on infrastructures for collecting and sharing and using research data and thinking about the ethics of doing that work. And I'm one of the principal investigators in the PERVADE project. PERVADE is a 6-institution research project focused on answering empirical questions in data ethics. We're funded by the National Science Foundation, and we're studying how people react to their pervasive data being used in research, how data scientists are grappling with ethical questions in their work, and how regulators such as university institutional review boards are guiding data-intensive research. And this webinar series really highlights a number of researchers doing cutting-edge work in data science and artificial intelligence and data ethics and related fields. And for those of you who are attending, feel free to ask questions through the Q&A function, and we'll try to get to them as quickly as we can throughout our discussion today. So today I am joined by Dr. Camille Nebeker. I'm very excited about this today. Dr. Nebeker is an associate professor with appointments in the University of California, San Diego Design Lab and the Wortham School of Public Health. She's also director of the UC San Diego Research Ethics Program and is affiliated with the Institute of Practical Ethics. She co-founded and directs the ReCODE Health Center, which provides education and consultation services to guide ethical practices in technology-supported health research. Dr. Nebeker applies a human-centered design approach to shape ethical research practices, which has led to the development of various decision support tools. She also serves as a member of the World Health Organizational Digital Health Roster of Experts, the American Association for the Advancement of Science Committee on Scientific Freedom and Responsibility, the IEEE Organizational Governance of AI Working Group, and the Society of Behavioral Medicine Digital Health Council. Dr. Nebeker's research has received support from federal, foundation, and industry sources, including the NSF, NIH, Office of Research Integrity, the Robert Wood Johnson Foundation, and IBM. And I'll post a link to Dr. Nebeker's publications here in the chat. And I'm excited about this. Dr. Nebeker and I first met several years ago as part of a project called the Health Data Exploration Project that was funded by the Robert Wood Johnson Foundation, looking at some of these questions about how to use pervasive data in health research. And I'm excited to have the chance to catch up. So welcome, Camille. It's great to see you.
Thanks, Matt. It's good to be here.
So let's just start off with a broad question. Tell me about what you're working on, what's exciting you right now.
Oh, we're working on so many fun things. We've got recent funding from the National Institutes of Health that is a nationwide effort to create data repositories that are ethically sourced. So this is one of the first projects that I've been on that has put ethics at the front end of the design process for creating data repositories that will be used for machine learning and to develop artificial intelligence, predictive analytics that can be used to support diagnostics as well as prevention of disease. And so the press release just went out on that yesterday, and our funding started on September 1st. So that's exciting for me because I really, want to take the time to figure out what does that mean to have an ethically sourced data set, and who decides this. And so that's exciting. And in addition to that, we've also had a few of the National Institutes of Health bioethics supplements and have really focused on what does it mean to really have informed consent. So really thinking about when you're collecting, and this is when you're prospectively thinking about, I want to use a wearable sensor or some kind of a remote sensor to capture data about people for research purposes. how do you gain consent? How do you explain to people what the granularity of the data are? And so this is when you actually are trying to truly get consent, not that you're passively collecting and using data for research that the people don't even know about. So, I mean, there's two ends of that spectrum, but we're really trying to figure out what meaningful consent looks like in the digital age and how do we do it. So those are a couple things that I'm excited about.
That's great. I hear, in your around the question of consent, but in other ways too. One of the things that we've been thinking about a lot with PERVADE is the question of sort of power and justice being real sort of key concerns for how we use this kind of pervasive data. Who has the power? What are just uses of that? How do you think about that in your work?
Well, in the one project where we're really thinking about meaningful consent, this is going to be a prospective longitudinal study where people are going to be using a wearable sensor. It's going to manipulate their behavior based on what their daily behaviors are and their preferences. And so this is an opportunity for us to talk about how these algorithms are manipulating as part of the consent process. So really trying to give people more education around what's under the hood, so that they're able to be more conscious about how these different tools are influencing behavior, as well as capturing their daily patterns to provide nudges. So I think that how we educate is, I think, a key to the power balance, and at least it's one stepping stone. And the pushback on that is, oh, it's expensive, it's going to take time. And I see this a lot in the health setting. So if you've heard about the learning health system, these are when clinics or hospitals are continuously experimenting with things that they think will affect change in health. And many of the clinics are now using digital tools. They're using the electronic health record, and they're making decisions about patient care based on these analytics. But it qualifies as quality improvement. So it doesn't go through the IRB pathway because it is separate from research with human subjects. It doesn't fall in that bucket. And so it also means that you don't have to get prospective consent from the patient population that you're using to analyze these data. And when I think about the principle of respect for persons, this is really, I think, how we think through this power dynamic. How do we explain what we're doing in a way that is accessible to people, that helps educate them about what we're learning from this process? And so I'd like to get away from thinking about consent as a transaction, and instead, how do we use consent as education? So if you don't have to get individual level consent because the regulations don't drive you down that pathway, what is our responsibility as a healthcare system, as people that are using patient data to drive decision making? And I'm starting to think more about, how do we put signage up in clinics or in the public setting, just to let people know what kind of data are being collected and what kind of decisions we're making. It's happening in our parking lots, it's happening in our buildings. People know how many people are in a building nowadays and can kind of regulate movement and crowds, your parking space, all of that kind of thing. And so I think the more we're able to figure out how to educate in small bits, I think that that's going to start shifting the power somewhat.
Yeah, I want to ask you about that education aspect, and I like the idea of signage, because I think one of the challenges that we see with pervasive data is often we don't have that sort of moment. The first study you were talking about that involved, for example, actually working with a device and collecting very specific data from people that may change their behavior, there's sort of an opportunity there for that consent, or there's a moment at which someone is enrolled. But with pervasive data, often people aren't even aware that their data is being taken or being used or has these alternate uses. Where can you say more? And you mentioned the signage idea, but how do we think about informed in that space, about the ethics of informing?
So do you think that in the scenario where people don't know, Is that because they have clicked on I agree? Is that how they get to the point where any data are being collected about them? Because if that's
I
the
think
case,
so. I think that there's, you know, and I guess part of this is a question about whether or not signs are enough, or
I think it
are
has to
we?
be multimodal. It has to be, you know, it has to be coming in many different ways. So when I think about clicking on I agree, I had to do that this morning for my Visa card to get through a password. And instead I decided I'm going to let it just take my face. And I really thought about this, like, do I want it to have my face? But my face is going to make it easier for me to get in, and I'm going to go ahead and do that. No, I didn't read it. I clicked I agree. And I know I can go back and change it, but right now I just needed to get in. So I hurry up and move through it. And I think that's a pretty common behavior. So what I'm thinking about, and I wrote about this in I think it was the Journal of Alzheimer's Disease. We were actually thinking about what do we do with consent when we're enrolling people that have a specific condition that they can't undo? Okay, so you're enrolling them because they have early onset Alzheimer's. Now they know something about themselves that they didn't know before. You know, and so how do we use digital technologies to keep track of people who may be disturbed, distressed because of news? And so I've been thinking about this idea where if I fill out my own terms and conditions of use, and I say, this is what I'm willing to share, and this is who I'm willing to share it with, under what circumstances. So I go through this checklist of sorts, and I kind of put my disposition around these different ways of gathering information about me and sharing it. And so anytime I'm coming up to an opportunity to click I agree, the AI scans my terms and matches it to the terms and conditions of whatever company is trying to get my information. And if I don't align, it gives me a yellow sign, it gives me a red sign, or it says green, you know, this is good to go. These are the good guys. They're doing the right thing. So I would like to see a system like that. I don't think signage is going to do everything, but if we could put more barriers in place to help people get what they need quickly, and I don't have to read the terms and conditions because the AI is just matched up my preferences with what the reality is. So that's what I'm thinking. We have to come up with some really innovative ways of doing this.
Yeah, and I like that you're thinking about sort of the power of these technologies, not just as this is, again, I think part of the justice is bringing some of the power of the AI to the person being researched as well, not just to the researcher on the research side, but sort of sharing that across both sides of that. I know one of the things, and you mentioned this, and we've talked about this a little bit already, but one of the places that you've been active is in the world of precision health. And I know for a while, I don't know if this continues, you were working with the All of Us project, and thinking about that sort of very large scale kind of collection of data. How do these kinds of things, what are there issues of scale as we move to larger and larger populations that affect the way that we think about that sort of power and those power and justice questions?
And that's, you know, the All of Us research program is one example of, it's probably the first example of one of the largest data repositories that is in motion right now. And since that time, let me see, I'm going to try to see if my little bird can go outside and stop squawking. Sorry about that. As soon as he hears my husband, he just starts squawking. So since that time, there is the RADx-RAD, which is diagnostics for COVID. So 50 awards going out, all of that data are going to be put into the NIH data repository. So the thing that I was thinking about with that one, in I am working with the data coordinating center. So 50 awardees matching up to this data coordinating center. And we said all of the data have to be de-identified. We cannot pull information into a data repository unless it's de-identified. But with the tools we have now, what does that mean? How do you get de-identified data? And so we have people that are doing mathematical work to make sure that the data are separate. But yet, if I were to join a different RADx-RAD study, and they put a unique identifier on my file, I could be matched up with another study that I'm in. And now, did I agree to that? Am I still de-identified? And so I think it's really important as these gargantuan data sets are coming into the NIH repositories. I guess my question is, what's the Henrietta Lacks of next year? I think we're heading into something that if we're not doing this with, consent and thoughtfulness, and this not only requires that that our federal agencies be mindful of the potential risks, that they don't put this on an IRB to figure out, because oftentimes that's not going to, they don't have the sophistication to understand how, what are the downstream social implications or potential harms. And those harms can vary depending on who you are, where you live. And, are you really de-identified? When they start granularly looking at LGBTQ in small county in Tennessee, goes, so there's so much that makes it difficult to really protect people. But then there's so much excitement about the potential for protecting and promoting human health that comes from this. So I weigh this. Yeah, there's some risks, and we have to be really mindful and do more to make consent better. But we can't be shady. We have to know ourselves what happens downstream and not outsource it to some other group to figure out. And so I think, if the NIH has some responsibility, or whatever the funding agency is, the organizations, the researchers, the people who are enrolled in these studies, and this concept of participant as partner is something that was part of the core values, is part of the core values of the All of Us research program. What does that mean to be a partner? And so that kind of dialogue, what does it mean to return information back to people? How do you give information back so that it's bi-directional and there's a learning opportunity that's coming from it and it's actionable? And the biggest thing is that people not be stigmatized or lose coverage because all of a sudden something is known about them. So the discrimination and stigmatization, if we can control for that, I think we can do a lot of really exciting things. But those data repositories are, this bridge to AI is one of them that, like I said, we're building it. And how do you do that and do it in a way that is trustworthy and respectful, and with the idea that the people will benefit from it? And when I hesitated earlier about, having tribes involved in this, they get no benefit from things that happen with their data, and they've learned that. And so why would they want to contribute to an NIH data repository when they don't get anything back from it? So I think that bi-directional benefit has to start showing up.
Yeah. I was just, when you mentioned the stigma and the identifiability and things, it just struck me again. I was looking yesterday, or saw a news story yesterday about monkeypox vaccine availability, but simply having in your health record that you've had a monkeypox vaccine at this point in time reveals a lot about you and your identity and your behavior that maybe some people don't want to share, and often stigmatize things for the LGBTQ community. And so I think it's a really interesting question about sort of that prospective kind of uses of data, what might happen with it in the future. You mentioned the tribes, and this is something I wanted to ask you about a little bit as well. And you've written about this, about the role of community health workers, promotores, and their role in ethics. Can you talk a little bit about that and what you see as their role? And is that a model that we can expand? Is it something that is, because I know community outreach is something from the very first work that I did with you was something that you were very interested in, and thinking about how do we work with communities and bring them into the research as partners. So can you say a little bit more
that's
about that?
probably my entry into public health research was working with promotoras and trying to figure out how to develop educational curriculum to teach them about research ethics. And this came right after the requirement from NIH to, require training for all key personnel. And, my public health colleagues, I was working at San Diego State at the time as director of research affairs, and part of my responsibility was human research protections. And, we were thinking about how do we respond to this requirement for education for our graduate students and faculty. And this is before the city program existed. This is, pre all of that. And we were trying to figure out, well, what's the appropriate kind of education? How long should it be? Who should get it? How should it be delivered? And then my colleagues said, we have a lot of monolingual Spanish speaking women who are helping us reach communities for recruitment, for data collection, intervention, delivery. And this was a precursor to community engaged and community-based participatory research, which has really exploded in the last 25 years. So I started working and learning about promotoras and realized that they were very much involved in research because they're trusted. They're trusted by their community. They understand the traditions and the customs and the language, and they can help researchers not only design their studies appropriately so that they'll be acceptable in the community setting, but they also are involved in data collection, and they did not know what the scientific method was. And so when I first observed that they were making changes in the protocol because it didn't make sense for them to do it a certain way, and they didn't feel empowered to go back to the researchers to say this isn't going to fly. So just learning about their role was super important. And we created curriculum that we call Building Research Integrity and Capacity, which has been deployed in community settings for the last 20 years. We now recently just finished a curriculum called Designing Research for Diversity, which is for researchers to learn about how to be involved in community research and do it respectfully. But I think these community navigators, there's probably 200 different names for a community health worker, but they are truly a big part of the workforce that we could leverage to start working more closely with communities. And when we were developing CA Notify, the exposure notification for the state of California, we took the product and did design workshops with women in Chula Vista, which is South Bay in San Diego, mostly Latina populations. We did 2 workshops in Spanish to learn what would influence adoption of CA Notify, which is, do you have it on your phone?
Yeah.
You activate it on your phone, and then you get alerted if you've been in proximity to somebody who's tested positive that you may have been by at the library or at the grocery store, but you would never know who they were. So this tells you that somebody you were around tested positive, and you should probably start being more cautious or get tested and quarantine until you know what your status is. And it wasn't getting adopted in certain parts of the state, and those parts of the state, because we could see by county, sort of, we don't have granular data, and the whole purpose was to preserve privacy. So we don't have a lot of data that pinpoints anything, but we could tell that people in certain regions were having a disproportionately high level of COVID positivity. And we weren't seeing the uptake of CA Notify in some of these areas. So we went to them and said, what is it about how we're communicating this technology? What is it about the look of the website or the app on the phone that is either appealing or not? Now, these are resident leaders. It's another word for a community health worker. They're going to be the ambassadors that go into their community and say, this technology is trustworthy. This is something you should adopt. And so we learned from them what the barriers were. And this was super important because they told us, and it may be urban legend, it may be something that they know from an experience, but they didn't know how Bluetooth worked. And that was the key undergirding of that entire Google Apple exposure notification platform. And Bluetooth was used because it was the most privacy preserving technology that was available. And GPS or your location wasn't being collected at all. But they had this idea that if they had Bluetooth on, their entire phone was vulnerable to having information either dropped into it or taken out of it. And not being a technologist, I didn't know how to explain it. So I was able to take those kinds of comments, worries about privacy, worries about how the technology could take information or drop information into their phones. And we took it back to the Google team and said, we need to have a really easy way of explaining this. And then we went back and we said, how does this, what is this, how is this resonating with you? And so a few back and forths, and they helped us redesign for that population. And then because they were involved in that design process, they were going to be advocates and try to get people in their community to adopt because they felt it would keep their communities safer. So, it has to be, I think, a much more level playing field, and involving community members is super critical, especially when we're talking about diverse populations. We did something very similar with a youth advisory group that is in City Heights, which is mostly, I think it's 23 different ethnicities in City Heights, but a lot of the refugee population. And we were thinking that the youth might be the people that take the information to their parents and grandparents. And how do we convey information to them that they're likely to share with family members? And so I think it's super important with any kind of technology that more people are involved on the ground that can help us understand what that lived experience is and those perceptions that influence acceptability and adoption.
I think that's a great point, that ethics isn't even. It's a landscape, and it varies and across communities and cultures, and that there are variations that we need to understand in order to do ethical research that may look different in different places, but also requires really engagement.
Yeah, same with older adults. I took some of Dr. Bloss's outcomes from her privacy with adolescents, collecting information about preferences for privacy.
Mm-hmm.
Took some of those, I think we took the same scale and asked older adults to complete it. Really different ideas about what privacy means to older adults than it does to the people who are digital natives. And so I think just being mindful of those differences, and whether it be cultural or age related. And especially with age, people over 65 are going from maybe 13% of our population to somewhere around 26% of our population. Yeah. And the need for not only digital technologies. So we published a paper last year that talked about the impact on physical and mental health among older adults who were quarantined. And it was a qualitative study that we published in JMIR Aging. And they needed technology and they didn't know how to use it. We were able to get 25 people on Zoom. It took a lot of time to get 25 older adults onto Zoom. But then, the fact that they went to church on Zoom, they resurrected their book club. They needed to have this access, and they didn't know really what to do until, it took some time, but the impact on their physical health was pretty significant. Yeah. And mental health. And you think about that population doubling in size globally. And, they call it the silver tsunami. This is not only just physical health, but their mental health is really also, it's like 1 in 5 has some mental health challenge. And these digital technologies are going to be critical for accessing services. So having trustworthy systems in place is life-saving. So how do we get to that point of knowing what's under the hood? And I see vendors coming to our health system selling shiny objects all the time and saying, oh, it's only going to cost $1 per patient. And I see the vendors, the procurement group, not knowing what questions to ask of the shiny object seller. And so, it's not just researchers, it's clinical care. And you probably know about the state of California deploying a mobile technology in its public mental health system. they signed contracts all over the state. And did the people signing the contracts know what to ask about the evidence that would support whether this technology was going to be helpful or potentially incredibly harmful for probably our most vulnerable people in the state?
So we have a question from one of our participants. The newish HR 8152 has a subsection called individual data ownership and control, but it's not really ownership. What needs to happen for patient data ownership to go national so that patients can get more control and or criminalize the pejorative use of our information?
Wow, Juhan, that is and I hope I said your name correctly. That is a $1 million question. Data ownership is so complex, and I've got colleagues that are super sensitive about privacy and didn't realize that our UC Health system was sharing patient data with Google. And when that was learned, she came unhinged. Like, how does this happen that my health data, mine, but is it really mine? So there's a lot of, and I'm not an expert in this area, so I'm not going to try to answer that question. I just think that there's a lot of discussion about patient data. Is it property? Who owns the property? And this gets into a whole conversation about legal and regulatory pieces of data ownership and access and use.
It does remind me that I think, with a lot of people think about HIPAA as the health privacy law, but its main purpose is actually to ensure the portability of data.
Yeah, it doesn't protect your data, or it just means that other people that need to pay something can access. It's all about billing, right?
Mm-hmm. Yeah. So I want to turn a little bit and ask, so we've been reflecting on these questions of power and justice and culture and informed consent and et cetera. How do we turn this into research methods? How do we make this practical or practicable for researchers?
So if it's a researcher, and this is also a really kind of a strange place to be. I always encourage researchers to add aims, exploratory aims, when they're doing digital health research, using different kinds of sensors or voice collecting technology, a mobile app, and can you add an aim that helps us understand more about informed consent? These bioethics supplements have helped us a little bit with doing some research in this area. Researchers tend not to want to put aims in their study that focus on ethics because they think it's going to trip up the reviewer. So they don't want to cause any noise when that review is happening. So, and I get it. So it's part of this is grantsmanship. So the NIH, this is my last trip pre-pandemic, was the National Academies, where we were hosting a workshop on the future of bioethics and what's coming down the pike. What do they need to be paying attention to? And so a lot of around citizen science, around structural racism, about just things that we need to be paying attention to. And that's when they were really focusing on these bioethics supplements, which are really only $100,000 for 1 year's worth of work. I think we need to do more funding for ethics research and make that part of a commitment, especially as these studies are moving so quickly. And I think that's what Bridge to AI is attempting to do, is putting ethics at the forefront. And another thing that I thought was really interesting about the Bridge to AI is that there are modules. So they have an ethical and trustworthy AI module. They have standards module, they have the tools module, they have the data acquisition module, and they have a teaming module. And this is really fascinating because team science is what's so critical to advancing a lot of this really innovative research. And how do these different disciplines and sectors get along? How do they communicate? And how do they do their work in a way that's going to produce useful knowledge? And, so I'm not sure if I'm answering your question, but I'm thinking like with our consent work and with our return of information work, we're doing a lot of surveys. We're asking people, how do they want to receive information? What kind of information? What's the cadence? A lot of folks want to meet the research team. They want to know who we are. There's, just like the opportunity for interaction and ongoing learning and bi-directional, that's all coming to the forefront in our research about, if you want us to be in studies, we need to have more information about what you're learning about us, what you're learning about the data that you collect about groups. And so, it's interesting because then I was on a call with part of this National Precision Health, which is nutrition. It's a first ancillary study out of the All of Us research program. And so we were looking at the consent flow for the All of Us program. And in there, they say they return information, but what they're doing is making publications available. And people don't read publications. I mean, so what's the next step? And so we've done research on that, where we've taken our peer-reviewed papers, we've taken a next step, which is more consumer facing, which was a rework of our paper by a contributor of Forbes, and it came out in Forbes. And I was like, wow, that's really cool. They just took our paper and redid it so it's more public facing. I didn't know you could do that, but I thought it was pretty interesting that they take that and move it into, accessible. And then we took that to our older adult community and said, how do you like this? And how do you like this? And they said, we really just want a big poster or an infographic. We want big letters, big pictures. We want to see what you did about us. So then we get into this quandary about returning individual level information, returning group level information, which is really contrary to our tradition as researchers. We don't return. We just publish. We get credit for publishing. So now it gets at, what are the metrics? What's our productivity based on? And are we motivated and incentivized to do the right thing by the people that are contributing?
I hear in the way you talk about this, and it's one of the things that I like about your approach, is that you can feel the tendrils stretching out, like all of these different systems from, we're going from how you get consent all the way through how do we incentivize and researchers, and what are the metrics by which we measure their progress, and how this all kind of connects. I think I also heard when you were talking about the idea of putting new aims in, or extra aims into research grants that are more exploratory. I get the sense that you feel like we aren't settled on what it means to have ethics around this data, or how we should go about it. I guess, let me just ask specifically, what is the state of norms or agreement about best practices in this research, in the research communities you work with?
I think they're just starting to form. And I mean, I am on as a consultant on a lot of grants for a small bit of effort. We just published a paper about research ethicists and where they fit on a continuum in the research world. So, I might be consulted at the front end where somebody has a question that might be more regulatory, human subjects. Can we do this? Should we do this? And then I never talk to them again. Or, then I'm on projects where I'm doing not only consulting to the team, trying to help them look ahead at what could happen downstream, how to shape it and avoid. So I'm working with them on design and thoughts about data acquisition. And then there are studies where I'm actually doing my own research within this larger consortium of people. So, the funders, and I want to get at this ecosystem, because when you talk about the tendrils, I use the behavioral ecological model when I think about the research ecosystem. And on the outer layer, you have funding agencies. On the inside, you have professional societies, you have organizations, you have your laboratories, and then you have an individual. So you have all these different layers of a system that you can tweak at different places to affect change, to make it much more of a healthy, holistic system. And at any point in this system, there could be a bad apple, there could be a bad policy, so you have to kind of have this bigger view of all the different players in the system. So in this paper we wrote, we were talking about how on this continuum, we fit in a lot of places. And at the same time, it's almost like having a journalist on your team, where they're like unpacking everything that could go wrong, or wanting to report on you if you don't do this way. So it's really it can be a tense, but it also can be a very collaborative environment. And I'm just seeing more, not huge, but incremental pushes toward researchers wanting to take more responsibility for being aware of what the downstream is and not outsourcing. So I'm feeling more positive about the state of research ethics in this digital environment.
So what resources would make addressing these ethics challenges easier?
And that came up at the National Academies meeting. There has to be, and this came up yesterday when we did our launch of the Bridge to AI for our data generation project, is I was talking about, we may need to do consent differently. It maybe isn't going to look like this 24-page document with half-inch margins. It might look more like something you'd want to engage with and learn from. We might need to talk to our community advisors about bi-directional return of information. How do we build this system in a way that's ethical and trustworthy? And then the data scientist says, but we don't have money to implement that, well, how are we going to implement that? And so when it comes down to it, it really is about funding resources from the federal agencies to make a commitment. And I think Bridge to AI is one example of that, because it is leading with ethical and trustworthy, ethically sourced AI. But it has to follow through. It has to follow through. And so if we say we're doing this and we get the right people on the bus that can do it, and the bus can't make it to the destination because the wheels fall off or something happens, we have to be there and we have to maintain it, and that requires support.
So you've mentioned Bridge to AI a couple of times. Can you say a little bit more about that and tell us about what's coming on the sort of data and AI ethics horizon?
Yeah, I wish I knew more, because again, I'm just learning about the different organizations. And you can Google it and look it up on NIH, because the main Bridge to AI site is there. So community engagement is a big part of that. Like how do we work with different populations? How do we educate our workforce so that we are building a pipeline of people that are sensitive to the ethical and social implications of designing these systems? Some of the data acquisition projects are using data from health centers. And our current regulations don't map to what this group is proposing to do. And so do we try, like I was saying with signage, how do we educate the patients that may be using that center so that they're part of the learning health system, that they're actually learning what we're doing? So I think we're on the right track. But, I do think that it'll be interesting to see how Bridge to AI starts to affect change. And because we do have the right people on the bus, I'm super excited to work with the folks that we're working with, but I'm also at the same time realizing that not only external, how do we bring the community into this consortium, but also how do we educate the data scientists and the engineers that we're going to be working with? I'm supposed to be cutting across 5 different modules with my team, so that we're starting to acculturate standards and data acquisition around, acculturating them around the norms and thinking of research ethics. And I'll keep you posted, because we're just starting this. And I'm pretty optimistic. And at the same time, yesterday when I was on that call, and I was like, okay, there's resistance.
What is that resistance? Where is it coming from?
I think it comes from the norms of doing research and what do you get credited for. And so you got the money, you said you were going to do these experiments, you get the paper published, you get another grant. So until our productivity metrics shift to having a bit more around social responsibility, I think we're going to be kind of in a quandary. And so, like, for me, when I go up for promotion, first time I went up for promotion, I was told that my qualitative data didn't matter, that I needed to find somebody with quantitative data so I could write a lot of papers quickly. And I said, but that's not what I do. And so I added a segment to my promotion letter. It wasn't just grants and papers and service. It was social and societal impact. I wanted them to know what I was doing in the community. It meant a lot to me. And unless I tell them that this is what matters, it doesn't get in there. So I think we all have to think more about what is our role and what is our, how do we convey and how do we value the work that we do with communities? Because I think that those kind of inner relationships are going to be really important moving forward. Public trust is going to be key.
Are there, so do you think, I wanted to come back to this, to the AI a little bit. Does AI present new data ethics challenges, or is it an expansion, or is it, because I know one of the things is it's sort of a more intensive use of data requires more data. So there's a scaling up, but are there things that we aren't talking about yet, or that we should be? Or do you see problems on the horizon that are showing up that we haven't thought about previously?
I do. And unfortunately, it's, some people are writing about this. Alondra, is it Dave Harris from the White House? She wrote a piece in Wired that I thought was very smart. But, you know, we're using AI on data sets that aren't representative, and they're perpetuating inequities and harming people who are already experiencing more health disparities than anybody else. So bias in the data is real. You can't get rid of it, but you can control for it. And that's what these new data generation projects are supposed to be really mindful of. So yeah, people are being harmed because the data aren't representative, and we're making inferences, and you know, we don't have a lot of structure in place for how do we do this. Like even thinking about real world evidence, real world data, what is that? And is it messy? Is it really, you know, solid and clean? So, you know, when it comes to AI, we really need to be mindful of not causing harm, especially when it comes to health. I mean, we've been using AI for airline reservations, for, you know, determining what our insurance rates are. I might have a higher insurance rate because I live in a dense area where DUIs might be more common and I'm having to pay that price, you know. But when we put together a lot of different data sources that used to be independent and siloed, and now you've brought them together, you have to think about what the risk is by bringing more data sources together that never touched each other before, because now you can know a whole lot more. You may even know that people that live at this zip code that are exposed to toxins. Now, what do you do about it? They can't move. And so what have you introduced harm, or have you solved a problem with having access to this new information? What I worry about is people aren't thinking about it. And so I was on a committee a year ago, and the excitement was, we want to save the hospital system a ton of money, and we can do this by managing our appointments better. And so we can apply this predictive analytic to our patient care system, and we can predict who's not going to show up for their appointment. And now we can double book them, because we want to make sure that slot gets taken, because that's revenue for us. And I'm sitting there thinking, that model is going to show you that the people that you double book are underrepresented populations, probably people of color. And it was like the first thing I thought about, and it wasn't anywhere near the first thing anybody else was thinking about. So that gap in I don't know how to fill that gap, Matt. What do you think? I mean, because I don't know, when I think that these are really bright people that would think about, there are people that can't get to their appointment because they're working 2 jobs, they're having transportation problems. You need to figure out what the social determinants are that are causing that problem and think about how to fix it. You need to run these models and learn what you're learning before you deploy it and save $2 million. So anyways, what do you think of
Yeah,
that?
I agree. And I think this is one of there's a tendency to bring AI to bear in a way that focuses mostly on the efficiency of the system itself, rather than on the well-being of the people who are providing the data for the system. And I think that it's one of those places where we need to really be careful and think about that. I also wonder, you mentioned about sort of bringing these multiple data sets together and the issue of bias. And one of the questions becomes, if there's bias in these data sets, if it's a systemic bias, when we bring the sets together, are we actually amplifying the bias rather than resolving it? And thinking carefully about how we're combining data sets, how they fit together.
Yeah, I mean, it has to be thought of. And I was asking one of my colleagues about, like, what are we missing as we build this AI infrastructure? And I think her analogy was just brilliant for me, because she said, if we're building a building on campus, we're going to be talking to HVAC, we're going to be talking to, who's building the streets, who's doing people movement. There are so many different actors that come into designing and building a building. So you have all the infrastructure there, you have all the different standards that are in place. And what we're doing, we don't have that. We don't have that yet. And so that's kind of what we need to be mindful of.
You mentioned, I'm thinking your example of being in that room and talking about the reservation system or the appointment system at the hospital. How do you bring up these issues in a situation like that? What is your advice about how to raise ethical issues in the context of research teams that maybe aren't as receptive?
Well, in that case, it wasn't a research team, it was clinical care. And I can't stop myself sometimes when and my question to them was, we cannot be the first people that are experiencing this question. What is the UC doing? So that ended up creating an opportunity that the UC Artificial Intelligence Governance Committee was just forming. And so I was on that committee, and we came up with a report that was published almost a year ago. The report's published, it talks about procurement, student admissions, criminal justice, the health system, what should we be doing and how should we be doing it? And now there's a team that's working on how do we implement this report, because once you write the report and it goes on a shelf, nothing happens. And so they're actually trying to get it into practice. So that's happening. On research teams, it's about developing relationships and becoming that trusted person, and credibility matters. And so, I think that just takes time and a lot of collaboration. My file's up for review now, and one of the comments about my file was that I am involved in so many collaborative papers. And it doesn't matter to me if I'm first or last, as long as I'm getting the conversation started with the scientists and the engineers. I just feel really lucky to have those opportunities to be involved in these interdisciplinary projects.
So we're nearing the end of the time. I just wanted to ask, as kind of a final big picture question, what lights do you see? What has been working well in the ethical space around data? Where do you see hope?
I'm always the optimist, and I've always been optimistic. And I think, again, the funding is coming. I've seen more funding for this work than ever before. We also have our collaborations with some of the big tech companies, where they're starting to really do some interesting work around bio and data ethics. collaborating more with some of the credible big bioethics organizations. So I'm seeing a lot more opportunities for conversation starting and engagement from the sectors that need to be present. So that's exciting. I really like, because when we think about the health tech companies like Apple and Google, they have a lot of impact. And so if they're trying to recognize that we have no listing of best practices just yet, but wanting to be at the table to shape those, that's really important.
Great. So just to wrap up, I want to thank you very much. This has been a great conversation. It's been so interesting and a great chance to catch up with you, Camille. And remind people, so you tweet relatively often. I see you're on Twitter, so at C Nebeker.
Yeah.
Is that correct? And also at UCSD, and as part of the new Bridge to AI grant. Good luck with that.
Thanks, Matt. And it's always good to see you. Nice to catch up.
All right. So thank you to our attendees. And thank you so much. Have a great day, everyone.